If you want to hear better in background noise, you need to know what your speech and noise score is. It is a common daily occurrence in hearing aid forums online where someone is complaining about not being able to hear well in a background noise situation, despite having really good hearing aids and constantly going into their hearing care professional for tweaks and adjustments to the programming. Yet, every single time that I reach out to these individuals and ask them what their speech and noise score is, they often tell me that they have no idea what I'm talking about. The problem is, the key to knowing how you should expect to hear in a background noise situation depends on how well you perform on a speech and noise test. A speech and noise test like the QuickSIN allows your hearing care professional to identify what your signal-to-noise ratio loss score is, otherwise known as your SNR loss. The scale that your performance is measured on using the QuickSIN test ranges between 0 decibels and 26 decibels, and the lower the score, the better. This test identifies how many decibels of speech you need above the background noise for you to understand 50% of the speech information in comparison to normal hearing individuals. For instance, someone with normal hearing in a background noise situation would have a 0 dB SNR loss score, which means that they can understand 50% of speech information when there is no difference between the background noise and the speech that they're trying to hear. However, if you have a SNR loss score of 10 decibels, that means that you need speech to be 10 decibels louder than the background noise before you can understand 50% of the information. Now, just so we're clear here, 10 decibels is a big difference because 10 decibels is technically a doubling in perceived volume, which means that a 10 dB SNR loss score would mean that you need speech to be twice as loud as the background noise. Basically, what I'm saying here is that if you want to be able to hear better in a background noise situation, you need to have your SNR loss score to be as low as possible. And if you have no idea what your SNR loss score is, then you have no idea if you're even capable of hearing better in a background noise situation, and being able to predict this without a speech and noise test is impossible. Alright guys, hopefully you're learning a lot from this video so far. We have a lot more to cover, but before I get into it, if you could do me a huge favor, click that like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well, because that makes sure that you never miss one of my newly released videos. And I release a bunch of new videos every single week. That being said, I really appreciate it. Now let's go ahead and get into the SNR loss score a little bit more. Okay, so based on what we know so far about a SNR loss score, the lower the score, the better, which means that it stands to reason that if you could get your score to be lower than what it is right now, you would actually do better in a background noise situation. One terrific way to get your SNR loss score down significantly is to have real ear measurement performed on your hearing aids. Now, if you do not know what real ear measurement is, I highly recommend that you check out my real ear measurement video that I will link in the description. Basically, real ear measurement is the only way to verify that your hearing aids have been programmed correctly to your hearing loss prescription. Not only does this optimize your ability to hear speech in a quiet situation and optimize your performance of all of your advanced digital features in your hearing aids, but it also significantly improves your signal-to-noise ratio loss score in background noise. In a 2012 study by Drs. Ron Levitt and Carol Flexer, they identified that modern digital hearing aids that were only programmed to manufacturer first fit settings significantly underperformed compared to an old analog hearing aid that was programmed using real ear measurement. When you look at a graph of these results, it is mind-blowing. These long black bars indicate the signal-to-noise ratio loss scores. You want these bars to be as short as possible. But look what happens when all of these modern digital hearing aids were programmed using real ear measurement. You can see this with the gray bars that are now significantly shorter. This means that every single one of these modern digital hearing aids sucked when it came to hearing in background noise if real ear measurement was not performed. But as soon as real ear measurement was performed, every single one of them performed significantly better. So if you're struggling to hear in a background noise situation with your hearing aids, but your hearing aids have never been verified with real ear measurement, then you're never going to perform better in background noise. Unfortunately, estimates show that only 30% or less of hearing care professionals actually perform real ear measurement when they're programming a set of hearing aids, which means the vast majority of people wearing hearing hearing aids are not going to do well when they get into background noise. I should also mention that just running real ear measurement doesn't make a difference. You actually have to program the hearing aids to the prescriptive targets and match them as closely as possible if you actually want to receive the benefit. Another interesting thing about signal-to-noise ratio loss is that some hearing aid users do better with an open-fit rubber dome, and other hearing aid users do better with a closed ear mold. A good hearing care professional can typically identify which one would be more appropriate for you by adjusting the speech and noise test parameters to use a high-frequency emphasis low-pass filter to accentuate the high-frequency speech components. If your SNR loss score decreases in decibels, which means that it's showing improvement when using this particular type of a filter, it means that you may do better with an open-fit dome. However, if your score increases, which means you get worse performance, it usually means that you need to go the route of a custom ear mold. Custom ear molds allow for better utilization of the directional microphones on your hearing aids that can give you up to a 3 decibel improvement in signal-to-noise ratio loss, and depending on which study you look at, this could equal up to a 50% improvement in background noise. Another thing that you can do to significantly improve your signal-to-noise ratio loss score is use an assistive listening device. An assistive listening device, like a lapel microphone, can reduce your SNR loss score by up to 9 decibels or even more. Think about that. You could have a really bad SNR loss score of around 10, and just by using a microphone that you clip onto the collar of the person that you want to hear, that can reduce your score of 10 down to a score of 1, which puts you into that normal range of hearing in a background noise situation. It can do this because the voice of the person that you want to hear goes right into that microphone, and it sends that wirelessly into both of your hearing aids, so background noise doesn't have a chance to mix in. Even the best hearing aids in the world that will cost thousands of dollars cannot get you a 9 decibel improvement in signal-to-noise ratio. Yet a few $100 lapel microphone can. You also have the option of using things like a table microphone for group situations like in restaurants, or a pointing microphone for cocktail party situations where you need to quickly switch between hearing multiple people. Now I want to reiterate this here. If you do not know what your signal-to-noise ratio loss score is from having a speech and noise test performed on you, then it is impossible to know if you're performing your maximum level in a background noise situation, and that will continue to haunt you. So if I were you, I would do everything in my power to locate a hearing care professional who performs a speech and noise test, which means that you are likely going to have to find a hearing care professional who follows best practices. An easy way to find one of these professionals in your local area is to go to hearingup.com and find a Hearing Up Network member near you. Hearing Up Network members are committed to following comprehensive best practices, including speech and noise testing, so you can hear your absolute best in background noise. Now, every survey ever done in history about what hearing aid users want, every single one of them has indicated that people want to hear better in background noise. So it is not surprising to see basically everybody complaining about how well they're doing in a background noise situation in these online forums. But until you understand what your SNR loss score is and what you can do to lower your SNR loss score, you're going to continue to be dissatisfied as well.